Okay, this is the Foley catheter insertion video, and I'll begin by reviewing my order, make sure I got the right patient, performing the right procedure. Also look at my allergy list, specifically for latex and iodine in this case, and gather all my appropriate supplies. So I got my sterile catheter kit, my non-sterile gloves, my wash rags, and a wash basin with mildly soapy water, all for the perennial care I'll be doing. I'm going to start by performing hand hygiene. If I had antimicrobial rub around here, I'd do that, or just wash my hands and don any PPE necessary for this patient. And I'm going to start by doing the two patient identifiers. So get the wristband and look at the birth date and name, and I check that before coming in the room, make sure it matches, and also ask the patient for their birth date and name, make sure everything matches up. Then explain the procedure to the patient. So today we'll be inserting a Foley catheter into the urethra and the bladder and then draining out the urine. And at this point I can provide privacy, bringing the curtain all the way around, no one peeks in. And then get a trash can, make sure it's in reachable distance, make sure I have adequate lighting. And raise the bed to proper working conditions, proper working mechanics. And I'm right-handed, so I'll be on the patient's right side performing this. And at this point, I can uncover the patient and put them in dorsal recumbent position. This is a female patient, by the way. Dorsal recumbent with the legs flexed. Mannequin would let me. There we go. Okay. And I would uncover the patient, and at this point, drape them over the midsection right there. I don't have any drapes with me right now, but drape them there. Then any part over the calf without compromising my sterile field that I will set up in a second. And at this point, I can put on my non-sterile gloves. Now I'm going to get my washcloths, dip them in the basin full of mildly soapy water, and wash the outside, the perineal area. Get a new side of the rag, just one stroke per side of the rag. Wash the other side, get a new one, soak it, then wash the inner aspect. Get a new side of the rag, the other side, then get a new rag, and just go right down the middle, soak it, middle. And then if I had another rag, I'd just pat the area dry. And now I'm going to remove my gloves and perform hand hygiene again. At this point, I can set up my sterile field. Just touching the outside of this wrapper. Now I'm going to get remove this to the side. Okay. Grab the sterile drape by the outer 1 inch and go shiny side down. Now I'm going to don my sterile gloves, just touching the outer 1 inch of the package. And now I'm going to get my hydrogen peroxide and squirt it over my cotton balls. And that there. And then grab my lubricant and disperse it in the little area right there. I'm going to get my syringe, plug it in the green port, the balloon port. And now with my non-dominant hand, I'm going to spread the labia until I see the urinary meatus, and I'm going to hold this position until I see the urine flow. Over here. Now I'm going to cleanse the area, the outer aspect, other side, and the inner aspects. And if I had one more cotton ball, which I don't in this one, I'd go just straight down with it in the middle. Now, all it's come over here. Grasp the catheter from 2 to 3 inches from the top and lubricate it in the little cartilage I filled with lubricant earlier. Get right over top. So lube it up in there and then insert into the urethra. And I've blown this balloon up so many times it may not go in too easy. So, not too bad. Okay, and once I see urine start to return, I'm going to go 2 to 3 more inches. Okay, then I'm going to grasp the catheter near the meatus and then inject all of my sterile water into the balloon. Okay, once I've done that, I'm going to pull back and assess for the resistance. I can feel the resistance, so now I'm going to detach that and get rid of all my supplies here. At this point, I grab my basin, bring it on over, and have a new washcloth. Would not use the old ones, but again, provide perennial care again. Do the outer aspect, flip it around, use a new side, other side, dip it in, and then wash the inside, flip it around, other side, and then for my last one, just pat the area dry. At this point, I can take off my gloves. And just tie this with a Velcro strap around the thigh right there, and then make sure the drainage bag is dodging, or first of all has no kinks in it, and is not connected to any movable parts of the bed, and is not in the way of any side rails that may come up and hit it. Okay, that would be secure right there. Now I'm going to assist the patient back to a comfortable position. Take my drapes off if I hadn't done so already. Recover them there, and bring their blanket back over. Lower the bed to the lowest position. Go. Lower these side rails. Make sure they have a call light in place. There's not one over here, but make sure they got one of those. Assess the patient's response during the procedure, then wash my hands again, and then document that I'm done.